Welcome back. We've been talking a lot about the lack of testing kits for the coronavirus and also the long wait expected for that vaccine, probably the better part of a year. Now, even though the president says we're going to see one soon, here experts say it's going to take a whole lot longer than his projection, likely, as I said, maybe up to a year and a half. Now, another major concern, the situation at America's hospitals. Experts say that we could see shortages of everything from beds to supplies to, if this infection spreads, nurses and doctors. There are also open questions as to whether the country has enough ventilators. Now, that came up during a recent congressional hearing when Republican Senator John Kennedy asked the acting Homeland Security Secretary whether or not we have enough of those machines.
Sorry, I don't understand the question. Head of Homeland Security, do we have enough respirators or not?
For patients, I don't understand the question.
For everybody, every American who needs one who gets the disease.
Again, I would refer you to HHS on that.
You're supposed to keep us safe, and the American people deserve some straight answers on the coronavirus. And Senator, I'm not getting them from you.
Now, it's not just the hospitals, it's also the healthcare system that is also worrisome. I'm going to quote here from a piece in The Atlantic that raised some, I think, very valid points here. A threat as dire as the new coronavirus exposes the weaknesses in our society and our politics. If Americans could seek testing and care without worrying about co-pays or surprise bills, and if everyone who showed symptoms had paid sick leave, the United States could more easily slow the spread. But a crisis finds a nation as it is, not as its citizens wish it to be. Another question is, what could happen next? Is Italy our future? 16 million people in the northern part of that country currently are under lockdown, meaning they can't move in or out of a big chunk of their country. The Interior Minister said people who try to flee the lockdown zone could face a few months in jail. Also, schools, theaters, bars, nightclubs, and even churches have been shuttered. Also, the outbreak has hit the very top of the Italian government. The head of Italy's Democratic Party, that shares power in a coalition government, has just tested positive for coronavirus. Let's bring in our next guest here. Earlier today, Andrew spoke with Pam Belluck. She, a health and science writer for the New York Times, she awarded the Pulitzer Prize for her coverage of the Ebola epidemic.
Pam, let's start with the kits and the ability to test people. President Trump, of course, said anyone who wants a test can get one. We know that's not true. Is there any idea when it might be true, and what exactly is the delay? Is this something that could have been avoidable if we had begun prepping sooner?
It probably could have been avoidable. Yes, well, there have been a couple of things that have happened. One is that the initial kits that the CDC sent out to the state and local health departments had a problem with one of the components. So there were some test results that weren't accurate. So they've been sort of scrambling to try to fix that and get testing kits that work. They have sent out some more over the last week or so, but they still haven't really been able to scale up. So they really need to rely on private companies that are developing these tests. And just in the last sort of week or so, the Health and Human Services Department and the FDA have been taking steps to try to fast track the development of those testing kits, but even with this sort of fast track approach, it'll probably be several weeks before we get a lot more tests out there, and that's what a lot of governors and local health officials have been increasingly frustrated because, on the one hand, they're getting this, the public is getting a message saying anyone who wants to be tested can be tested, when clearly that just isn't the case.
And the testing has understandably gotten a lot of attention, but there's another worry that's really starting to come into view, and that's the strain on both hospitals and our overall medical system. And the numbers here are daunting, depending on the on how you look at it. Between 1 and 10 million Americans may need to be hospitalized. Between 200,000 and 3 million Americans may need to wind up in the ICU. First of all, it's frightening just in the abstract, but let's put that in perspective. What's our current capacity in terms of hospital beds and ICU beds?
Well, I believe the best estimates I've seen are that hospitals in the United States have about 65,000 critical care beds. So if you even take that sort of conservative number that you use, 200,000 people, we're still talking about, outmatching the supply of critical care beds, by 3 times. So it is a real concern, not only the capacity of ICU beds and critical care beds, but also the right kinds of hospital rooms. Ideally, you want patients who are really sick with coronavirus to be in a negative airflow room where their germs don't get, sort of funneled to the outside of the room where health workers or other patients could be infected. And not every hospital has a big supply of those rooms or is able to convert its rooms into that. And then you just have, problems that we've already seen and that happen with these kinds of outbreaks, that who's on the front lines caring for these patients? Well, it's health workers, and they're going to be, there have already been a number of cases of health workers being infected. And so then you run into a staffing problem, and then there's also sort of the protective gear problem, having enough masks, having enough protective gear for workers who are taking care of these patients. So it is a real problem, and that's one of the reasons why the messages that they're trying to give to the public is ways to just kind of slow this progression of the spread across the country down. I think they've given up on the idea of what they call containment, taking a person who is sick and quarantining them, and then, you don't have to worry about it.
I'm going to cut into that interview here. I want to go to the White House, to the briefing room, the president giving us the latest on the virus's status.
Shut down our borders. We're the first ones ever to do that. We've never done that in our country before.